I gotta check my blood pressure. All right, goodness. All right, sorry for the scare, folks. All right, we're good to go. And let me just make sure we're in. Perfect. Okay. All right, fantastic. All right. Thank everybody for coming. Most people don't even want to hear my voice once. Thank everybody for coming. Thank John Goldfarb from physical therapy specialist in Saybrook for coming and doing this presentation. It was a great presentation at Saybrook, and in that, no problem. We agreed to do a second showing. So, information, and
for the intro, and thank you guys for taking time out live about dizziness and vertigo. Before we get started, I just wanted to get a gauge of everyone's either your experience or your understanding. So has anyone here by raising the hand either themselves or known somebody who's had vertigo before or dizziness? Yeah, that's pretty common. So today we're going to be talking about, we're going to introduce the concept of balance. I'm sure you've heard this all over from either doctors, friends, loved ones about working on balance, improving balance. So we're going to talk about exactly what that is. We're going to identify the causes of benign paroxysmal positional vertigo. Has anyone ever heard of that phrase before? Anyone ever heard about crystals being dislodged in your ear causing vertigo? That's what we're going to be talking about today. We're going to understand the signs of it, symptoms, as well as how we diagnose it and how we treat it. First, talking about balance. Before we get there, there are a couple of conditions we need to be on the lookout for. The first one being, as always, a stroke. So we have an acronym called FAST, which is just a quick screening tool. So we want to look out for balance or coordination issues. Eyesight changes, especially rapid changes, loss of vision. Looking at facial drooping, especially unilateral drooping. Difficulty speaking or difficulty understanding. And then making sure that you're doing that in a manner, understanding when the symptoms started, getting treated right away. So any of those issues, call your primary care room, as well as any dizziness that's associated with hearing loss. That's another type of dizziness, another type of vertigo that you better find your ENT, sometimes your primary care, as well as dizziness that's provoked by head movements or neck pain or migraines or headaches. Those are other conditions that can be looked at by primary care, neurology, ENT, therapy. So those are other things we want to be on the mind, on the back of our mind when we're thinking about dizziness and vertigo. So what exactly is balance? Basically, it's the integration of multiple systems in your body that keep your head up. It's designed so that we don't fall, we don't hit the ground, and we don't hurt ourselves. First system is vision. So you use your eyesight, you use your sense of vision to see the horizon and where you are relative to that horizon, as well as seeing any potential hurdles or potential obstacles that you play as you're walking. So if you've ever noticed, when you get older, we tend to rely more on our vision as we age. So if you've ever noticed you have trouble when you're getting up and going to the bathroom, you have a hard time understanding where you are in space, usually because we end up relying a little more on our visual system as we get older. So people that have compromised vision can have a higher risk of lying, as well as when we're in low light environments. Proprioception. This is the idea we have receptors inside of our muscles, ligaments, joints, and tendons. And these receptors tell your brain where your muscles and ligaments are in space. So if I close my eyes and somebody lifts my arm up, I can tell you I lifted my left arm or my left arm is lifted, even though I didn't see it. There are receptors in all of our muscles, ligaments, and tendons that tell your brain that information. So what ends up happening for people that have, say, where you would lose that sensation, you can lose that proprioceptive feedback in your ankles and feet. And that can make you more susceptible or have a higher risk of fall. The last one is vestibular. So this is the system inside your inner ear that gives your brain direct information about where your head is in space. So we're going to talk a little bit more about BPPV specifically. So inside your inner ear, calcium carbonate crystals right over here. And their original home, they belong here, inside the inner ear. What happens is they can get dislodged, stuck in one of these three canals right over here. Those three canals act like your body's internal gyroscope. So they tell your brain about any angular motion, side to side, up or down, I'm spinning like this. That gives your brain information. What happens when you get these crystals that are dislodged, you get this reflexive twitching of your eyes called nystagmus. So if anyone's ever experienced it or had somebody say, it feels like the world is spinning, what's actually happening is the eyes are twitching, so they can't stay focused. So they're literally seeing the whole world spinning because their eyes are getting that reflexive twitching, that nystagmus. That's that sensation either you've experienced or your loved one is describing. As a result, you get this mismatched information between what the inner ear is telling your brain, what your eye is telling your brain, and what the other systems are telling your brain. So you get this reduced balance because you're having this mismatched information from these three different systems inside your body. So how common is BPPV? In the general population, not super common. About 2.5% of the average population has BPPV, has had it at some point. However, that gets more common as we get older. So about 7 times more common in people 60 years old. The typical age range of having BPPV is usually between 50 and 70. With women more commonly having it than men, 2 times more likely to have it than men. Exactly sure why that is yet, but we have some. About 9% of older adults have undiagnosed, meaning they haven't necessarily been treated or diagnosed with BPPV. They might have these symptoms. They might have the vertigo, they might have the spinning, or they might have the balance. Of those, they are about 2.5 times more likely to make sure we can diagnose these, we can find them, we can treat them. Because about half of people that go to a fall center have undiagnosed BPPV. So this is a very important condition that we want to address. We can make sure that people don't fall, so we don't have those other negative outcomes that are related to fall. So what are the symptoms? We talked about vertigo already, that's the last of these. It's a sensation of spinning or movement where either the person or their surroundings appear to be moving or spinning. It's for BPPV, it's always triggered with specific positions or specific movements. So you're turning in bed, you go to bend over. It's a very specific diagnosis, a very specific pathology. So that's what we're talking about. You can always reproduce it with a very specific position. These symptoms usually are very short. They usually don't last a minute. So they come on very fast, and then they go away. And then you're left with kind of sensation of feeling, or I've always had patients usually describe it as tend to have worse balance afterwards. Walk around, and people kind of looking like they're drunk. Sometimes people will get nausea or vomiting. Sometimes people will even have a sensation of their ear being full. They'll feel like they have wax stuck in one side of their ear. It's not necessarily wax. So how do we test for it? The gold standard is testing using positional testing. So we want to put patients in specific positions to test if the crystals are in a specific canal, a specific side. What we're looking for is either a reproduction of that vertigo sensation and or having that reflexive twitching of the nystagmus that I was talking about earlier. If you have that and it goes away, that's usually indicative of having BPPV. I'm not sure if anyone's ever familiar with the test called the test or the supine roll test, and both of those assess all 6 canals. So how is it treated? rehab under the guidance of a physical therapist is the gold standard. Have canal repositioning, which is a combination of factors, which in what we want to do is get the crystals out of the canal and go back where they should be. So I think this does a great description. So here, crystals are dislodged. She's getting dizzy. You're going to see that in the eyes. But then you notice as the crystals start to settle, then they turn her head, and we're getting the whole idea trying to get the crystals from here all the way back where they should be. The whole time we're monitoring to make sure to check for any dizziness, nausea. Finishes, the crystals are now out back where they need. That's the first line of defense. Bring the crystals back where they need to go, back to their home. So that maneuver I just showed you, and I'm going to demonstrate. There are other procedures we can do depending on the side, depending on the patient. That's the most popular one. That's the one that most people have heard of. The next part is balance training. So now we got the crystals back where they needed to be. Sometimes people still have limited balance. So we want to work on different exercises. I would imagine you guys have probably seen exercises like this. Yes.
How do you keep the crystals where they belong?
Wonderful question. So I was going to bring this up later. You brought this up now. Fortunately, there's no way to guarantee that they don't come back. Recurrence are pretty common with BPPV. So there's no muscle I can have you train. I wish it could prevent these crystals from getting dislodged. What we do know is once if they do come back, some people they never do. Some people it happens once every decade or every years or so. Once they do happen again and they are back or they should go away quickly. So usually about 80% of people get better with it. So it comes on fast, but if we catch it correctly, we can get it to go away fast. So there's no way to prevent them, but treat them pretty quickly. Yes.
I feel like I know I'm going to have a.
Yes.
As I start to feel.
What you're probably getting is the crystals are starting to, and then you get into the position, they settle, and then once they're out, all of a sudden you feel the world spinning, everything is really
I start the exercise before, or the first time I feel a twinge.
Mhm.
Seems to, and then I keep going on 3 times. Oh, I don't have any.
You're fantastic. You should be coming up here. Yeah.
I've had this since
Yeah. So you're absolutely right. If you and therapy should be consisting of his patient education, and the therapist should teach you how to do these moves. That way, you have a say in your treatment to manage your symptoms as well. The only thing I will say is it's not always that your recurrence would happen on the same side of the body and the same canal. So it's always a good idea to follow up with the therapist to make sure that you are doing the correct side. It's pretty common to have it in the same side and the same canal. That's what I've seen, but it's not always the case. So you are welcome to try it again on yourself. I would recommend you come in just so we can confirm and make sure that you are doing the correct treatment for right now. Did that answer your question? Wonderful. Yes.
Is there anything we can do at home? I say maneuvers, but exercises move?
Unfortunately, no. There's really no muscle strength. There's no exercises we can do to prevent. They're trying to understand. They're trying to figure that out. It doesn't seem like doing the maneuver over and over again prevents it. 1 in 20 chance you can knock it into a. We don't recommend doing the maneuvers if you're not feeling the vertigo. Any other questions on that topic? And you've got a lot of great questions. But getting back, these are a lot of exercises that you work on after the symptoms have resolved. Make sure that your balance is as good as it was before the symptoms happened. So that's going to be done here. It's going to be done with George here at Joint Effort as well. So it's a team approach. And the last one. We talked about putting the crystals back. Talked about balance. Next one is gaze sensitization, and so this actually tries to improve the strength, improving the efficiency of the signal from the ears to the brain, and then processing the brain. It also works on desensitizing people. If you have irritation with a specific movement, people can be more inclined to avoid that movement, and that makes symptoms worse. So these types of exercises try to work on both getting comfortable with moving your head and moving your eyes in space, as well as strengthening that connection between the inner region and the brain, so that your brain gets good information about where the gyroscopes are working in space. And then our last piece is getting back to regular exercise. So we already talked about the prognosis. We know that about 80% of people get full resolution symptoms within 1 to 3 sessions. But like I mentioned before, accurate diagnosis is key. We have to make sure we're treating the correct canal on the correct side of the body. Otherwise, the maneuvers will be. And the last part is getting back to George, getting back to your regular routine, getting back to regular exercise. It's going to be very important to maintain your strength, balance, maintain anyone want, so I was going to do a brief demonstration of the maneuver itself of an actual person. Anyone feeling vertigo right now? Does anyone want to go through it? You're going to have to see George get spun around.
No takers.
So I'm going to have you guys. So we'll go through a brief, kind of what a brief vestibular exam would look like. The first thing I'm going to have him do is just do some visual tracking to make sure his eyes are behaving well. So just follow the tip of my finger. How am I doing? You're doing great. Yes. Perfect. Then your head, we're just going to look at a quick cervical screen to make sure he's not getting any dizziness in this position. As well as giving me information about what maneuvers I can do, what maneuvers I might not be able to do because of either neck pain, stiffness, arthritis. Here. We are going to assume that the crystals are dislodged on the side. Compare to say to the left. And then we're going to quickly lay down on 3. 1, 2, 3. Like you saw in the video, at this point, you're feeling really dizzy. You would have that twitching of the eye. You would wait at least 30 to 60 seconds after. And turn his head to the right. Not going to feel any dizziness. Sometimes people do. Wait 30 to 60, and then George just roll onto your right side. In this position, people usually feel dizzy. Again, it goes away 30 to 60 seconds. And then just put your legs over and sit up. There you go. That's the maneuver. That's the epic maneuver. Yes.
Yes. I was off for the entire day.
That is perfect.
It is.
So what's happening when you go through these maneuvers, you make yourself very dizzy. That can cause an overstimulation of the vestibular nerve, which then is not firing at the right frequency, at the right rate, the right efficiency for the usually the remainder of the day. What I usually find is people feel off the rest of the day. Then you feel much better the next morning. So it's a very common response to this type of treatment. You feel wonky the rest of the day, and the next morning you should feel much better. The vestibular system gets a chance to recover, your body acclimates to what just happened, crystals are gone, so then you wake up and you feel much better. That's extremely common.
Okay.
And I tend to make sure that people know that before they leave. So that they don't think that it didn't work. Some people will feel immediately better. And what I find to be exactly what you described, where they feel a little wonky, they feel a little off the remainder of the day, then you feel much better the next day.
You only do it.
Great question. It depends. It depends on the course of it, your acuity. If somebody's almost throwing up in the clinic, I will test it. If you're a little less acute, a little less severe of a case, I will retest it out to see if the maneuver did work. What you should find is you tested it the first time, they had the dizziness. If I do the maneuver and I test it again, it should be negative. It shouldn't have any symptoms the second time around.
So do you use for just different?
Yes. George, come on over.
Done.
You lay it back. Don't bring something different. Yep. So that last treatment you just saw was the posterior canal. So let's say it's in the horizontal canal. Less common. Posterior is about 80 to 90% of cases. Horizontal about 10 to 20%. Say it's in the left ear. So if I tested it like that, felt really dizzy. I have him do. Wait. He would just go on, turn his head to the right. Wait. Roll onto your right side. Wait, and then roll onto your stomach. How you would treat the horizontal canal. So different canal requires a different procedure. That's one of the reasons why the effing doesn't work for everyone. That's why getting in, making sure that we are.
Is there any
Yes.
surgical options to help the crystals out?
Yes, in very severe cases, you can actually plug up.
Oh.
The only problem is you then create hypofunction on that side of the body. So you basically create like permanent mild dizziness to prevent the acute bouts. More obviously, that's what PTs do. We're not doing surgery. That is do for if it's really you never get it keeps coming back. It doesn't get better, not get better. You can just plug that hole so the crystal can't get stuck anymore. But obviously, surgery has some side effects, risks associated with it. Phenomenal question. Any others? This is great. Yes.
Hands up.
No, that's okay.
If you have most or all of the other symptoms except the virtual vertigo, you have PP without a V, how is this?
When you mean the other symptoms, do you mean? What do you mean?
Have to stop. Somebody said, that's beautiful.
Okay, so you're having all those other symptoms. Do these tests. Is that your question?
Well, I had like,
Dizziness.
Got it.
That's a good idea.
had or spinning.
So there are other things that can cause dizziness. There's also things that can cause vertigo. It could be one of those other conditions, or it could be one of those untreated conditions, or put you in the position you've never been in the position that tested it. So you might not know that you have it, but you're having enough of an effect. You're having secondary symptoms. Not to say off the top of my head, but there are either diagnosed or there are conditions that can cause dizziness as well.
We're to go for an evaluation.
Yep.
And you evaluate all of the possibilities.
Some of them, yes. Some of them, it would have to be referred either to a neurologist. But in terms of ruling out BPPV, ruling in other physiological conditions, I can't. Physical therapist can't do. There are some that I wouldn't be able to do, and I would refer to ENT neurologist, someone else down the line.
Someone for the evaluation.
Yes, absolutely. And then if you're appropriate, if not, we'll send you to the person who can help you. Yes.
Did you ever see Vertigo's symptom or outcome of long COVID? Or
Yes. They are finding there are some people having some systemic issues stemming from long COVID.
Yeah.
Usually not, but some people can get dizziness. People have reported feeling vertigo. People have also had another issue that causes this sensation of dizziness, spinning.
Yeah.
I've seen this too with long COVID. I haven't seen it for BPPV, but for getting any inflammatory response, it can be more likely. So we know that BPPV is seasonal, more common in fall and the spring. If we think this is allergies, if you're getting an inflammation inside the inner ear, it's more likely that can get ejected in the canals. So we're pretty sure, but we can't guarantee it.
Would Zyrtec help?
That's I recommended you take a Zyrtec for BPPV itself. Same thing. Ever heard of meclizine, antivert? They tend to recommend now that you don't take that with BPPV. It masks the symptoms and can make it harder to get an accurate diagnosis. I put you in a position and you don't have it. I don't know if it's because the meclizine is inhibiting it enough that you're not experiencing anything, or just because you don't have it. Great question, too. Yes.
This would, if you have nerve.
Deafness
I don't hear at all in this.
shouldn't affect that at all.
Oh,
Unless there's another condition that causes dizziness and hearing loss, that would be something that wouldn't be something else. But BPPV should cause hearing loss by itself. It's a very mechanical treatment diagnosis. Crystals are, they shouldn't be. It should only cause you to feel dizzy. It shouldn't cause hearing loss.
now,
Yes.
right.
Yes.
So, but I could still go have treatment.
Yes, absolutely. Yeah, the hearing loss would have nothing to do with it.
Thank you.
You're welcome. Any other questions? I had an FAQ section, but you guys answered almost all of them so far. Let's see if we get a few others. But you guys are awesome. One. This is one. So if you noticed when we did the it involved a decent amount of so a question and a common concern people have, especially if you have arthritis or neck surgeries, is can you still be treated? There are a lot of different treatments we can do. So I can tailor whatever range of motion you have. So there is more maneuvers than just that one specific canal. We can tailor it to what your body is allowing us to do. Can you still exercise? Can you still be active? Absolutely. Exercise is strongly encouraged. Maintaining your regular routine is strongly encouraged during the process. Is there danger to actually going for itself and treatment? Not really. Some people you'll feel like you might be a little off the rest of the day. You might feel vertigo during the procedure, but all of those are transient. You should feel better afterwards. Can it come back like you asked before? Unfortunately, there isn't much we know of right now that can prevent it. However, treatment can go away within that same 1 to 3 second cycle. That you're accurately treating it and diagnosing it as. Any other questions?
If you, let's say you feel to the first treatment, you wouldn't go to the second one?
You still would. What I would look at is I would retest.
Yeah.
When you saw in the video when it's one crystal, it's so the maneuver won't always get every single out of the Sometimes we solve them, but not always. So we check if they're not gone, you're still getting some vertigo, you're still getting some again, then recheck. Also, I usually do at least a 1 week follow-up. This maneuver can, like I mentioned before, stimulate the vestibular nerve. Sometimes it takes a week for that to calm down. Sometimes we need to take a little longer, and there are some other exercises like the exercise I was talking about before. You kind of retrain and get the vestibular nerve and the vestibular system.
So what you did on was the, no,
That was the treatment.
oh, that was.
The diagnosis is the first part of it. Laid down his left side, laid all the way back. That was the test, the Dix-Hall test.
The rest.
The rest is the Epley maneuver. The posterior canal, yes. Yes.
You have to be because of the different careers, right? What if you don't know the human? Yeah, you can't always help if it's short. It's going to the spinning is going to the left. What do you do then? Because I want to start places have a really session.
So you're saying you're testing yourself.
Right.
Generally, we go by some.
You never can tell the
Yeah. If you can't tell, usually go by the severity of the symptoms. Whichever side causes you worse symptoms, most likely the affected side. So if I do it to my hand, I think it's the right side. If I test the right, we get really bad symptoms. And then I test the left, I still get vertigo. As bad. You would do the side that, even if you don't get the side that elicits more symptoms. Just had it this morning, actually. Any other questions? Thank you guys so much. You've been a phenomenal group. You've asked really great questions. And thank you again so much for having me again. Come talk.
And so I like to point out every time PTs from physical therapy specialists, I always like to point out there's a lot of physical therapy practices out there that a lot of times you work almost more with a physical therapy aid than you actually work with a physical therapist. Everybody had that experience with physical therapy evaluation initially, and the vast majority of other sessions are actually with an aid. So that's the reason why I like working so much with physical therapy specialists. You're always with a PT. Doctors of physical therapy, and it's one-on-one with them. The PT doing the evaluation, and then you're off with physical therapy aid, which is fine, but you should really be with the PT every single session, and that's why we really strongly work with them. If you have anything for the evaluations and things along those lines, so this way. Thank you again, John, for running this back. All right. Thank you, everybody.
You guys are doing great.
And part.